Okay, welcome back to the deep dive. Our whole goal here is pretty straightforward. We take these huge subjects, things that seem, well, overwhelming, and we try to break them down, distill them into something you can actually use, the key insights. And today, we are tackling, honestly, the absolute bedrock, the foundation of all biology, all medicine, human anatomy. Now, when you hear anatomy, what probably pops into your head? Maybe a skeleton hanging in a corner. Or, that classic image of a classroom dissection perhaps seems a bit old-fashioned.
Yeah, that's the common picture, isn't it? This is the kind of historical image.
Exactly. But that view, it's really not the whole story, not even close, actually. See, modern anatomy is massive. It's dynamic. We're talking about, 11 key parts, 11 subdivisions that we're going to unpack. It goes way beyond just, the scalpel and the deceased body. So our plan today is to map that out for you quickly, but thoroughly. Give you that structural vocabulary, that framework, so you feel fluent. So starting simple, maybe the most basic definition. What is anatomy?
Well, at its heart, the core definition holds true. Anatomy is the science that deals with the structure of the human body, how it's built. Simple as that, really.
The structure, got it.
But as you often find in these foundational sciences, the history, it's sort of baked right into the word itself. If we unpack anatomy, it comes straight from ancient Greek, the word anatomy.
Anatomy. Okay.
And what that literally translates to is cutting up.
Cutting up, right. So that sounds exactly like dissection.
Well, yes and no. And this is actually a really crucial point, especially if you're trying to get a quick, solid grasp of the subject. You might immediately connect anatomy, the Greek cutting up, with its Latin equivalent, which is dissection.
Makes sense.
But here's the thing. Anatomy and dissection are absolutely not the same. They're not synonymous, even though people often use them that way.
Okay, so how are they different then?
Think of it like this. Dissection is just a technique, a tool. It's the physical act of separating tissues to see what's underneath.
Right, the method.
Exactly. Whereas anatomy, that's the field of study, the science. It's broad, it's expansive. Saying dissection is anatomy is like, I don't know, saying a hammer is the entire field of carpentry.
Okay. That's a good analogy. The tool versus the whole discipline.
Precisely. Dissection was how we first learned a lot about anatomy, but anatomy itself is the knowledge we gained. And now it uses, well, tons of other techniques, way beyond just cutting.
And that distinction feels really important because, as our source material points out, understanding the structure, the anatomy, that's the firm foundation of the whole art of medicine. Yeah. It's not just a starting point. It's where most of the medical language comes from, too, the terminology. It's like the dictionary you need before you can even start reading the book of medicine.
Absolutely. It's the essential language system.
But why? Why is structure the absolute starting point? Why not function or disease?
Well, there's a classic analogy in the source material that captures this beautifully.
Okay.
The idea is anatomy is to physiology as geography is to history.
Anatomy is to physiology as geography is to history. Let's unpack that.
Right. Think about geography. It describes the physical stage, doesn't it? The layout of the land, the mountains, rivers, cities, borders. It's static in a way. It's the description of the theater.
Okay, the physical space.
Then you have history. History is the action, the events, the dynamic stuff that happens on that stage within that geography.
Right, the story playing out in the space?
Exactly. So anatomy is the geography of the body. It defines the structure, the physical theater, and physiology. That's the function, the action, the history that takes place within that theater.
Ah, I see. So you can't really understand the history, the function, without first understanding the geography, the structure, where it all happens.
You've got it. It clearly separates structure from function and shows why anatomy has to come first. You need the map before you can understand the journey.
That makes perfect sense. It establishes the where before you get to the how or why.
Precisely.
So that structural foundation, the body's geography, historically, the main way in was through that technique we mentioned, dissection.
That's right. For a very long time, anatomy was primarily studied by, well, cutting up deceased bodies. That was the main window.
But, and this is key for anyone learning this now, while dissection is still fundamental, modern anatomy is much, much wider. It uses all kinds of techniques now. Anything that can sort of push the boundaries of what we know about structure.
Exactly. We're not just limited to what the naked eye can see on a non-living body anymore.
Which leads us neatly into the first and maybe most traditional subdivision.
Okay, subdivision 1.
Subdivision 1, cadaveric anatomy. This is the classic stuff, what most people imagine. It's often called gross anatomy or macroscopic anatomy.
Gross meaning large scale, not unpleasant.
Correct. Macroscopic, visible to the naked eye. And it's studied on dead bodies, usually ones that have been embalmed, preserved.
Right.
Now, even within this classic approach, there are two main ways to organize the information. Two ways to sort of carve up the body intellectually. Okay, what are they?
The first is regional anatomy. This is where you study the body section by section, or region by region.
So like studying the arm is one unit?
Exactly. You'd study everything in the upper limb region, all the bones, muscles, nerves, blood vessels, all together in that specific area. Then you'd move to the lower limb, then the thorax, that's the chest area, the abdomen, the head and neck, and the brain as its own region.
That sounds very practical, especially for surgery, maybe.
Historically, yes. Extremely practical.
Yeah.
If you needed to operate on a leg, you need to know everything about that leg region right then and there.
Yeah.
The very localized spatial way of thinking.
Makes sense. What's the other way?
The second approach, which is arguably more useful today for understanding how the body works as a whole, is systemic anatomy.
Systemic. So studying by systems, like the nervous system, digestive system.
Instead of regions, you study specific systems that perform particular functions throughout the entire body. And this is where we really hit that core medical terminology, the olomatologies.
The adologies, right. Okay, let's get into those.
So you have the skeletal system. That's the bony framework, the scaffolding. The source material has a figure, 1.1, showing this overall structure. The study of the skeletal system is called osteology.
Osteology, osteo for bone. Got it.
Then the muscular system, all the muscles responsible for movement, that's myology. Myo meaning muscle.
Myology, okay.
The joints, where bones connect and articulate, that falls under the articulatory system. And its study is called arthrology. Sometimes you might see it called syndesmology, but arthrology is more common.
Arthrology, like arthritis affects the joints, okay?
Good connection. Then the network of blood vessels, arteries, veins, capillaries as the vascular system, studied under angiology.
Angiology, for vessels.
And the body's communication network, the brain, spinal cord, nerves.
Yeah.
That's the nervous system. And its study is neurology.
Neurology, that one's pretty familiar.
It is. Now, here's where things get condensed a bit. Several major systems dealing with internal organs get grouped together. The respiratory system, lungs, airways. The digestive system, stomach, intestines. The urogenital system, that's kidneys, bladder, reproductive organs. And the endocrine system, glands producing hormones. These are all bundled under one term. Splanchnology.
Splanchnology. That's a new one. S-P-L-A-N-C-H-N-O-L-O-G-Y.
That's the one. Splanchno refers to the viscera, the internal organs.
So why group those specific ones together? Respiratory, digestive, urogenital, endocrine. Seems like a diverse bunch.
Well, think about where they are and what they generally do. They're mostly the internal organs located within the major body cavities, the thorax and abdomen. And they handle a lot of the core life-sustaining functions, breathing, processing food, waste removal, hormones. Grouping them as splanchnology is just a convenient shorthand in anatomy, referring to these major visceral systems collectively.
Right, okay. Efficiency. Instead of listing all 4 or 5 every time, you just say splanchnology.
You got it.
Now, what's really cool about this systemic approach, as you mentioned, is seeing how these systems work together. The source points out a key combination, right?
It does. It highlights that if you take the skeletal system, osteology, the muscular system, myology, and the articulatory system, arthrology.
Bones, muscles, joints.
Right. Combine those 3, and you get what's called the locomotor system.
The locomotor system. Locomotion meaning movement.
Exactly. It's the integrated system that allows us to move, walk, run, lift things, interact physically with the world.
So it's not just knowing the parts list, but understanding how the bones provide the structure, the joints allow the movement, and the muscles provide the force, like a biological machine.
Perfectly put. It's like a complex lever system. Bones are the levers, joints are the fulcrums or pivots, and muscles provide the effort or force. Understanding them together as the locomotor system gives you a much richer picture of how movement actually happens. It shows structure in action, even just looking macroscopically.
But I guess even breaking things into systems can be a bit artificial sometimes. You mentioned the locomotor system, but surely the nervous system, neurology, is crucial for telling those muscles when to contract.
Absolutely. That's a fantastic point. You can't really separate the locomotor system from the nervous system that controls it or the vascular system that supplies it with energy. So while systemic anatomy is incredibly useful for organizing study, you always have to remember that in a living person, everything is interconnected. It's one integrated whole.
That's a great transition, actually, because we've been talking mainly about the structure based on dead bodies, the cadaveric map. but medicine happens in living people.
Precisely. And that's where modern anatomy really shines. We need to understand structure as it exists and functions in a living individual. This takes us beyond the cadaver.
So what's the next subdivision?
This brings us to subdivision 2, living anatomy. As the name suggests, this is all about studying the body in living people.
How do you do that without, well, dissection?
Through a whole range of techniques, many of which are the absolute bread and butter of a clinical examination. We're talking about using physical senses and basic tools.
Like what a doctor does in an exam room.
Exactly. The source lists the core techniques. First, the 4 pillars of physical examination. There's inspection, simply looking carefully at the patient, observing posture, skin, any visible abnormalities.
Okay, just looking.
Then palpation. This is using touch, feeling the tissues, assessing their size, consistency, temperature, tenderness. The source actually has a figure, 1.2, showing muscles being palpated while contracted, feeling that living structure.
Right. You need to know what's supposed to be under your fingers to know if something's wrong.
Absolutely critical. Then there's percussion. That's tapping on the body surface, usually over the chest or abdomen, and listening to the sounds produced. Different tissues, air-filled lung, solid liver, hollow stomach, make different sounds.
Like tapping a wall to find a stud?
Sort of, yeah. It gives clues about the structures underneath.
Yeah.
And finally, auscultation. That's listening to internal body sounds, usually with a stethoscope. Heart sounds, lung sounds, bowel sounds.
Inspection, palpation, percussion, auscultation, the big 4.
Those are fundamental to living anatomy. But it also includes some technology, things like endoscopy.
Endo meaning inside, escopy meaning to look. So looking inside.
Exactly. Using a thin tube with a camera and light and endoscope inserted into the body to directly view internal structures, like a bronchoscopy to look inside the airways, or a gastroscopy for the stomach and upper intestine.
So you're seeing the anatomy live, as it were.
You are. And living anatomy also includes things like electromyography, or EMG, which measures the electrical activity of muscles in response to nerve stimulation. So it's showing structure and function together in real time.
Okay, so living anatomy is very hands-on, very clinical.
Very much so.
And that idea of palpation, of knowing what's under the skin just by touch or by looking at the surface, that seems like a specific skill in itself.
It absolutely is, and it has its own dedicated subdivision. That's subdivision 5, surface anatomy, also sometimes called topographic anatomy.
Surface anatomy, relating deep structures to the surface.
Precisely. It's the study of the deeper parts of the body and how they relate to the skin surface. Think of it as creating a mental map on the outside that corresponds to the complex geography on the inside.
And the source says this is incredibly helpful in clinical practice and surgery.
Essential, I'd say. Imagine a surgeon making an incision. They need to know exactly what blood vessels, nerves, and organs lie just beneath that point on the skin. Or think about giving an injection or drawing blood. You need to find the vein based on surface landmarks.
Right. You can't see the vein directly most of the time.
Exactly. You use your knowledge of surface anatomy, the position relative to bones, tendons, muscles, to locate it accurately and safely.
Is there an example?
The source gives a great one in figure 1.3. Palpating the dorsalis pedis artery. That's an artery on the top of the foot. Finding its pulse tells you a lot about circulation to the leg and foot, but finding it requires knowing its precise path relative to the foot bones and tendons you can feel through the skin. That's surface anatomy in action.
Making the invisible visible, or at least palpable.
Well put.
But we can make the invisible actually visible now with technology. That must be another branch.
Indeed it is. That takes us to subdivision 6, radiographic and imaging anatomy.
Ah, X-rays and scans.
Exactly. This is using technology to visualize internal structures non-invasively, going far beyond what surface anatomy or basic examination can show.
What kind of technologies are we talking about?
The source lists the main ones. Plain radiography, which is your standard X-ray. Figure 1.4 shows a chest X-ray. You can clearly see the ribs, the lungs, the heart shadow. Simple, but incredibly powerful.
And contrast radiography.
That's using a contrast agent like barium or iodine that shows up brightly on X-rays. So you drink it or inject it, and it highlights hollow structures like the digestive tract or blood vessels, making their anatomy much clearer.
Okay. What else beyond X-rays?
Ultrasound. Using high-frequency sound waves to create images. Fantastic for looking at soft tissues, organs like the liver or kidneys, blood flow, and of course famously used in pregnancy to see the developing baby's anatomy. It's real-time imaging too.
Right. And the big one, CT scans.
Yes. Computerized tomographic scans, or CT scans. These use X-rays taken from many different angles around the body. A computer then processes all that data to create detailed cross-sectional images like virtual slices through the body.
So you can see structures without the overlap you get in a standard X-ray.
Precisely. CT gives incredible anatomical detail, showing the precise relationships between organs, bones, blood vessels, and identifying abnormalities like tumors or bleeding with amazing clarity. It truly revolutionized how we study anatomy in living people.
Wow. So from just looking and feeling to peering inside with cameras to mapping it with sound waves and computed X-ray slices, the view of living anatomy has become incredibly detailed.
It really has.
And all of this, the cadaver knowledge, the living exam skills, the surface mapping, the high-tech imaging, it all feeds into the practical application, right? Using this knowledge in medicine and surgery.
Absolutely. That's the endpoint, the practical payoff. And it forms Subdivision 9, applied anatomy, which is also often called clinical anatomy.
Applied or clinical anatomy. Makes sense.
This subdivision deals specifically with the application of all that anatomical knowledge directly to medical diagnosis and treatment, including surgery. It's about taking the map and using it effectively and safely in the real world of patient care.
So it's not just knowing where the appendix generally is?
Right. It's knowing its common variations in position, knowing which blood vessels supply it that need to be dealt with during surgery, knowing which surface landmarks guide you to it, knowing what it looks like on a CT scan if it's inflamed.
It's anatomy for action.
Exactly. Applied anatomy considers anatomical variations between people, understands the anatomical basis of diseases and injuries, and informs surgical procedures. It's about recognizing that the textbook average isn't always what you find in an individual patient and being prepared to navigate those differences based on a deep understanding of structure. It's where the geographical knowledge, the map, directly impacts the historical outcome, the patient's health.
Okay, that covers sort of where and how we see it aspects. What about other dimensions, like change over time or at different scales?
Excellent question. We focused a lot on location and technique. Now we shift gears a bit, moving into subdivisions that add context, the context of scale, development over time, and evolution.
Okay, where do we start? Scale seems like a big jump.
Let's go microscopic first. We've been talking mainly about gross anatomy things visible to the naked eye. But what about structures that are too small to see? That brings us to subdivision 4, histology.
Histology. Histo meaning tissue. Histology meaning study of tissues.
Precisely. It's also called microscopic anatomy. The definition is straightforward, the study of structures using a microscope.
So looking at cells and how they're organized.
Exactly. You take a tissue sample, prepared on a slide, stain it to make different components visible, and then examine its fine structure under the microscope. Gross anatomy might show you the kidney as an organ, but histology reveals the intricate arrangement of tiny tubules and filtering units, the nephrons that actually do the work.
So it's the bridge between the organ level and the cellular level. You can't really understand function without knowing that microscopic structure.
You really can't. Histology reveals the architectural organization that underlies the function of every tissue and organ. It's absolutely fundamental.
Okay, so that's scale. What about time? You mentioned development.
Right. That takes us to subdivision 3, embryology, which is also known as developmental anatomy.
Embryology, study of the embryo.
And the fetus, too. It's the study of all the changes an individual undergoes before birth, the prenatal development. How does a complex human body, with all its intricate structures, develop from a single fertilized egg? Embryology tracks that incredible process.
Watching structures form, migrate, change shape.
Exactly, and it's crucial for understanding birth defects or congenital abnormalities. If something goes wrong in that developmental process, the resulting structural problems can often be traced back to a specific event in embryology.
Now, embryology also brings in a couple of key terms, right, about history.
It does. This is a really important conceptual distinction for you to grasp. The developmental story of one individual, from conception onwards, your personal journey of structural formation, is called ontogeny.
Ontogeny, my development.
Right. But we often understand ontogeny by comparing it to the evolutionary history of the entire species, or even related species. That broader evolutionary timescale is called phylogeny.
Ontogeny is the individual's history. Phylogeny is the species' history.
Perfect. Think of it like this. Ontogeny is your life story, maybe 9 months prenatally, plus your lifespan. Phylogeny is the entire family tree of life, stretching back millions, even billions of years that led to humans.
And why is phylogeny relevant to my individual development, my ontogeny?
Because often the stages an embryo goes through during development, ontogeny, reflect or recapitulate stages from our evolutionary past, phylogeny. For example, human embryos briefly develop structures resembling gill slits, not because we need gills, but because our very distant ancestors were fish. Seeing these phylogenetic echoes helps explain why development proceeds in certain, sometimes seemingly roundabout ways.
So ontogeny recapitulates phylogeny. The development of the individual mirrors the evolution of the species, at least to some extent.
That's the famous, though sometimes debated, idea, yes. Understanding that evolutionary context, the phylogeny, is often key to making sense of the twists and turns of ontogeny.
And that evolutionary context itself sounds like another whole field of anatomy.
It is. That's Subdivision 7, comparative anatomy.
Comparing anatomy between different species.
Exactly. The study of the anatomy of other animals, fish, amphibians, reptiles, birds, other mammals, especially primates.
But why study, say, a frog's anatomy if we're interested in humans?
Because it helps us understand ourselves. By comparing structures across different species, we can trace how things have changed over evolutionary time. We can figure out the likely function of structures in our ancestors and see how they've been modified, or even become useless in us. It explains the morphology, the form and structure of the human body.
Like understanding why we have wisdom teeth that often cause problems or an appendix that seems prone to infection.
Perfect examples. Comparative anatomy shows us that wisdom teeth were useful when our ancestors had larger jaws and coarser diets. The appendix was likely larger and involved in digestion in plant-eating ancestors. Seeing these structures in other animals where they are fully functional helps explain why we have these sometimes troublesome vestiges. Evolution doesn't design from scratch. It tinkers with existing parts. Comparative anatomy reveals that tinkering process.
So it gives us the why behind certain structural quirks.
A big part of the why, yes.
Okay, so we've compared humans to other animals. What about comparing humans to other humans? Or looking at humans over time?
Good point. That leads nicely into Subdivision 8, physical anthropology.
Anthropology, the study of humans, so physical anthropology.
It's focused on the physical aspects, particularly human biological variation and evolution. It deals with external features, body measurements, skeletal characteristics, and how these differ among various human populations, both past and present.
So studying differences in height, body proportions, skull shape between different groups.
Yes, and also tracking how these features have changed over human evolutionary history by studying ancient skeletal remains. Think of fossils like Lucy or Neanderthals. That's a big part of it, understanding our own species' structural journey.
What are the applications today? Is it just academic?
Oh, definitely not just academic.
Yeah.
Think about ergonomics designing tools, furniture, workspaces. Physical anthropology provides the data on human body size and shape variation needed to make those designs work for more people.
Right, designing a car seat or an office chair.
Exactly. Also, forensic science relies heavily on physical anthropology. Identifying skeletal remains, determining age, sex, ancestry, even potential causes of death from bone trauma. That's all applied physical anthropology. It uses detailed anatomical knowledge to reconstruct identities and events.
So it connects structure directly to human variation, history, and even identity.
It does. It shows how anatomy intersects with population studies, evolution, and even legal investigations.
We've covered a lot of ground. From the scalpel to the CT scanner down to the microscope across evolutionary time. What's left? It feels like we've covered structure from every angle.
Almost. The last two subdivisions represent, in a way, the most modern analytical edge of anatomy. They move beyond just describing structure to asking why structure is the way it is and what controls it.
Okay, pushing beyond description to explanation.
Exactly. First, we have Subdivision 10, experimental anatomy.
Experimental, so doing experiments related to anatomy.
Precisely. This field studies the factors that influence and determine the form, structure, and even function of different body parts. It's not just observing, it's actively manipulating conditions to see how structure responds or develops.
Can you give an example?
Sure. A classic example is studying bone adaptation. How does bone structure change in response to mechanical stress? You could experimentally increase or decrease the load on a bone and observe how its density and shape change over time. Or study how tissues regenerate after injury under different conditions, or how development is affected by altered blood flow or environmental factors like zero gravity in space.
Ah, so it's investigating the causes behind the structure we see, like Wolff's Law for bone remodels based on stress. That came from experimental work.
Largely, yes. Experimental anatomy tries to uncover the rules and mechanisms that govern why structures form and adapt the way they do. It's looking at the interplay between genetics, environment, mechanics, and the resulting physical form. It really starts to blur the line between structure and the functional forces shaping it.
That really does sound like it's doing anatomy and physiology.
It absolutely is. It sees structure not as static, but as a dynamic outcome of various influences.
Okay, that's experimental anatomy. What's the 11th and final subdivision?
The final one brings us right down to the blueprint itself. Subdivision 11. Genetics.
Genetics. The study of genes and heredity. How is that a subdivision of anatomy?
Well, think about it. What ultimately dictates the structure of every single part of the body, from the overall body plan down to the shape of proteins within a cell?
The genetic code, DNA.
Exactly. Genetics, in this context, deals with the study of the information encoded in our chromosomes that direct the formation of all anatomical structures. It provides the fundamental instructions.
So understanding the genes tells you about the potential structure or why certain structural abnormalities, genetic disorders might occur.
Precisely. Why does one person have blue eyes and another brown? Genetics. Why does someone develop cystic fibrosis, affecting the structure and function of lungs and other organs? Genetics. Why does the embryo develop arms and legs in specific locations? Genetics controls the signaling pathways.
So anatomy isn't just about the final physical form, but also about the underlying information that creates that form.
That's the modern perspective, yes. Including genetics as a subdivision of anatomy acknowledges that the structural outcome is fundamentally determined at the molecular informational level. It connects the macroscopic world of organs and systems right down to the DNA sequence.
Wow. So from cutting up to reading the genetic code, anatomy really has expanded incredibly.
It truly encompasses everything from the largest systems down to the molecular instruction.
Okay, let's try and pull this all together then.
Right. So let's just recap briefly. We started with that basic image, maybe dissection or a skeleton, but we've seen anatomy as so much more. We explored cadaveric anatomy, the foundation, studied regionally or systemically, giving us terms like osteology, bones, myology, muscles, neurology, nerves, and that catch-all splanchnology for many internal organs.
Then we moved to the living body.
Right. Living anatomy using examination skills like palpation, surface anatomy for mapping deep structures, and radiographic imaging anatomy using X-rays, CT, ultrasound to see inside non-invasively. And all that feeding into applied clinical anatomy using the knowledge and practice.
Then we added context.
We did, down to the microscopic level with histology, across developmental time with embryology, remember ontogeny versus phylogeny, across species with comparative anatomy, and across human populations and time with physical anthropology.
And finally, the why and the how.
The cutting edge. Experimental anatomy, looking at the things of factors shaping structure, and genetics, the ultimate blueprint. All 11 subdivisions painting a really comprehensive picture.
So for you listening, you've gone from perhaps just cutting up to having this whole framework. You've got the terminology, the scope. You understand that anatomy is this vast dynamic field underlying all of medicine.
Absolutely. It's the essential structural foundation.
Which brings me back to that initial analogy we discussed. Anatomy is to physiology as geography is to history. Structure versus action.
Right. The theater versus the play.
Traditionally, yeah, they were kept quite separate. You learned the map, then you learned what happened on the map. But listening to those last two subdivisions, especially experimental anatomy, studying the factors that determine form and function, and genetics, studying the information that builds the structure.
I see where you're going.
It feels like those lines are getting seriously blurred, doesn't it? Experimental anatomy is explicitly looking at function's role in shaping structure. Genetics is the code that dictates both structure and potential function.
That's a very insightful point. The deeper we go, the harder it is to neatly separate the geography from the history that shapes it and plays out within it.
So here's the final thought, the provocative question maybe, for you to ponder now that you have this full map of anatomy. If the study of structure, anatomy, is increasingly about understanding the forces, the information, the functions that create and modify that structure, how long can structure and function really remain separate disciplines in how we learn about the body or how we practice medicine? Are they destined to merge?